Staff at the hospital became concerned earlier this year about the number of youngsters suffering cardiac and respiratory arrests.
Something untoward was happening at Grantham Hospital. 13 children had collapsed 24 times in a 59-day period. 4 had died.
There was things happening in that ward that normally wouldn't have happened, and it was horrendous.
They will have to decide whether this was a series of incredible medical coincidences or murder.
It was like having a die all over again.
I'm starting to want answers very quickly.
One name kept cropping up time after time after time. Beverley Allitt.
She's the only person that's been there, but we've got to prove it.
There is no direct evidence, there's no witness. She wouldn't answer the questions.
Do you know anything about the cause of this attack?
No reply.
You go into hospital with the expectation that they will help you, not that they will harm you.
We'll never forget what happened.
We've just got hate, I'm sorry.
To kill children. Who would do that?
A nurse is the last person you'd expect to turn out to be a serial killer.
On the 30th of April of 1991, I received a telephone call from a detective sergeant at Grantham Hospital. He was suggesting that something untoward was happening on the children's ward at that hospital. There were 13 children who had collapsed 24 times between them in a 59-day period. 2 paediatricians were at odds about whether the collapses were malicious or whether they were natural. Children collapsing without explanation. There was no common cause.
This photograph is Paul in January 1991. The photographs show a story of a happy baby, really. That's my overriding memory of Paul at that age, as being a happy, laughing, smiling baby. When Paul was 5 months old, he was admitted into Ward 4 Grantham Hospital.
I was on call on that particular weekend. Paul Crampton was a happy, cheerful 5-month-old baby. He was happily breathing, happily feeding, and was cheerful.
Ward 4 was a typical hospital ward. There were large pictures, you know, there was lots of colour on the walls. Staff generally, very helpful, very kind.
The ward was a very happy place, and people were very friendly, knew each other.
Paul Crampton had come into hospital with nothing more than bronchiolitis, not a life-threatening illness.
Paul was described by the hospital staff as a happy wheezer.
For the first 3 days of his care, nothing untoward happened. And in fact, they were talking on day 3 about him being able to go home.
I examined him and I said he's ready to go home. If there's any problem, you can bring him back. I think the parents were a little bit jittery. They said, "Doctor, is it all right if I keep him overnight?"
So on the Sunday morning, we went to the hospital. I walked into the room where Paul was on the ward to a scene that was very unexpected and very shocking.
Sunday morning, I was called as an emergency. "Can you please come? Paul Crampton is not well." I said, "What?" When I came there, he was very pale. He was breathing very shallow. It was cold and clammy.
He was grey and was in a state of collapse.
Seeing Paul so ill was clearly very distressing, very scary. We went from a child who was coming home within 24 hours to a child that was laid in a nurse's arms, was cold, clammy, lethargic.
I gave glucose to get the heart and the circulation moving again. Slowly he came round. It took a little while, but he did come round.
I can't remember the time period he was in there before we were invited into the room. But when we were eventually invited into the room, totally different picture again. Paul was sat up and I remember him playing with his toes.
I had a chat with the parents and the nursing staff. They really couldn't say what happened, except to say that he was found collapsed.
There's a sense of relief. Paul looked fine. So then, of course, after that, the questions started.
I went through again every minute who saw first and who called first. I couldn't come up with anything.
I was saying to the hospital staff, what is the cause? I need information. And not really getting any. It was they seemed confused and unsure. After a few days, we had the second hypoglycemic attack.
The drip was due to come down, and one of the nurses took down the drip, and he immediately went into collapse again.
We have a child that's now had 2 unexplained hypoglycemic attacks. You know, this was now really scary. Things were happening that couldn't be explained.
For the next 3 days, he begins to recover, and again they're talking about him going home. Around about lunchtime, the father, David Crampton, he decides to go up to the hospital canteen. He's only up there about 20 minutes, and when he returns, he sees his boy has become blue, cyanosed. He raises the alarm and the crash team are called.
So after Paul's 3rd hypoglycemic attack, he was transferred to Queen's Medical Centre in Nottingham in an ambulance under a blue light. My journey to Queen's Medical Centre was very distressing because I didn't know what I was going to find when I got there. And when I got to Queen's Medical Centre, Paul was in ICU. But I walked into a different atmosphere, an air of calm. As things transpired, all we needed to do to make Paul well was remove him from Grantham Hospital. You take a child into hospital because they're unwell, a place of safety, a place of security, a place where they're going to be cared for and hopefully get better. You do not expect the reverse. While Paul was in Queen's Medical Centre, we were aware that there was at least one other child in Queen's Medical Centre that had been transferred from Grantham.
We hadn't got any idea about why the children were collapsing. But it was astounding that we could have this high number of collapses and people were still saying that perhaps it's just a blip on a graph. I thought that there is something here that needs to be investigated.
In 1991, I was a detective inspector at Skegness. The superintendent, Mr. Clifton, who was in charge of CID at the time, rang me to say that there was an inquiry at Grantham Hospital and he was putting a team together.
Stuart Clifton called a meeting, particularly of the unit where I was working, the family service unit. He had no idea what was happening and basically said that he wanted our unit to make some inquiries and try and find out what was going on.
My brother, Neil Jones, was the other detective inspector.
We were told that there had been suspected damage to children at Grantham Hospital. We were told that there had been a number of collapses.
Children who had stopped breathing, who had had to be resuscitated by a team that colloquially was known as the crash team.
I like to think that we take every inquiry seriously, but obviously where this involved so many children over such a short period of time, you felt obliged to get to the bottom of this as quick as you could.
Every previous murder that I've worked on, you started with a body with an obvious cause of death. Here, what we've got is a dilemma in that we have children collapsing and nobody seems to understand why it's happening.
It certainly wasn't obvious that a crime had taken place. In fact, we were thinking that probably somebody had made a mistake. Possibly that there was a virus on the ward that was causing attacks in these children.
Some felt there may be water problem, Legionnaire's disease. Some thought this may be a virus going round.
I remember Stuart saying that he thought that the inquiry would take about 3 days to sort out. It was a fishing expedition, really, to see if we could work out what was happening.
In February, we had one 7-week-old baby who was brought ill. I happened to be on call.
Liam Taylor was a little boy. He got a chest infection. When he was admitted, they put him on a drip and his condition improved.
The father went to bed happy that his child was on the road to recovery. At about 5 o'clock in the morning, he's awoken by the night sister, who tells him that Liam has gone into relapse.
I saw he wasn't breathing. He was pale and clammy and didn't look right. There were no heartbeat.
The child is on life support.
To my confusion, worry and anxiety, I could not get his heartbeat going for almost an hour, which is very unusual.
The child has started convulsions, which is a symptom of brain damage.
I had to give up. And within few hours, he peacefully died in the hands of the parents. It was very, very upsetting. He shouldn't have died.
The post-mortem showed that he'd had a cardiac arrest, which was very, very unusual in 7-week-old babies.
I haven't heard babies having a massive heart attack unless there's a medical condition. I didn't accept it at that time. Even though it was a heart attack, they said cause of death was natural. I had no sleep for a couple of days, but I did have to accept. Maybe I'm unnecessarily worrying, so I just carried on.
In this particular case, there was no obvious cause of death. In fact, quite the opposite. It had been written off by pathologists as being natural. So I'm in the situation of not knowing precisely what it is that I was investigating. There was pressure from within the police service not to continue. I had this feeling that they were trying to say to me, go away, there's nothing in this, just write this off.
The chief constable came to visit, and he looked through the information that we'd received. And at that stage, he turned to me and said, Jonesy, I think you're chasing rainbows.
When you get 24 collapses on 13 children over a period of 59 days, it begins to say that there is something untoward that's occurring. There was a little girl called Becky Phillips who had been in the hospital with projectile vomiting.
Becky had been sent home. She became irritable and not well.
At about 3 in the morning, they realised that the child in the cot had stopped breathing. They grabbed up the child, drove to Grantham Hospital.
I was called by the A&E department team. They found she was not breathing, she was not having a heartbeat.
Becky Phillips was pronounced dead on arrival. Katie Phillips was the twin of Becky Phillips.
They brought Katie onto the ward purely for observation because her sister had died.
The next day, it was noted that one of the nurses had turned her bed through 90 degrees. And shortly afterwards, she suffered the first of 3 collapses. And there was nothing wrong at all with this little girl.
Within about 30 minutes, I was able to get her back slowly.
Now, sadly, Katie was probably one of, if not the worst affected child. She suffered convulsions and brain damage, which severely impacted her health.
I'm sure that would be directly related to lack of oxygen going into the brain for about 30-40 minutes.
For Sue and Peter Phillips, time spent with 8-month-old daughter Katie is very precious. At just 9 weeks old, she survived 3 unexplained cardiac arrests in the space of 4 hours. But for the Phillips, these moments carry with them painful memories. For little Katie's twin sister was not as fortunate.
It was like a nightmare. I just couldn't understand what I'd done so wrong.
I could see my world falling apart around me and just couldn't do anything about it. I just felt totally hopeless and helpless.
The police are investigating the cause of Becky's death and the deaths of 3 other children in suspicious circumstances.
The doctors dealt with separate children, so they didn't always see the same child. They had different views about what was going on.
To me, the deaths and collapses, most of them, except Katie, who was admitted because of my insistence, were ill and had a countable reason for their collapses.
When we recovered the post-mortem reports of the children that had died, we found that there was nothing untoward at all. The pathologist had really put it down to natural causes.
The report was very medical, and it put a lot of the problems down to the fact that the children had illnesses, but in medical terms they couldn't explain what was happening. They were unable to give an explanation for why most babies had relapsed, or why they'd had their cardiac arrest, or why they'd had a respiratory failure.
The only one that you could definitely say there was suspicion was for Crampton. Blood samples showed that there was huge amounts of insulin in his body.
It was quite clear to me that this was not accidental. This was something that was done maliciously.
Detectives were eventually called in after one child collapsed and tests showed unusually high levels of insulin in his blood. The child made a full recovery, but now police were investigating the possible misuse of a prescribed drug.
Paul Crampton suffered 3 collapses over a period of days whilst in hospital. Blood was taken from the 3rd collapse.
They had sent off blood samples and found that he had in excess of 500 milli units of insulin in this blood per litre.
That's a tremendously high figure in a child that should only have 10 or 15, you know, 50 times the level almost.
Doctors were sceptical about that figure. Their thoughts that it could be an error or a problem with the machine.
The doctors felt that it was probably a bodily malfunction that had righted itself. My gut feeling was that there was much, much more to it.
Superintendent Clifton was definitely suspicious, so he told us to concentrate on Paul Crampton.
We needed to try and find out a bit more about insulin. We were able to get hold of Professor Marks. He was probably the best insulin man in the country.
I received a message sort of brought to me urgently that the police were on the phone and wanted to speak to me. When I got to the phone, I found it was Detective Superintendent Clifton.
I spoke with him and he agreed to stop off in Grantham. He agreed to examine a sample of blood.
We diluted the blood several times and measured it at concentrations of 1 in 100, 1 in 200, 1 in 400, 1 in 600. We were quite amazed when we found an unbelievably high level of insulin.
He was absolutely astounded that it was the second highest blood insulin count that had ever been recorded.
It came back at 43,147, which is a complete file of insulin, really. It's an enormous amount of insulin.
And that was the first time that we established evidence. Hadn't established who had put it there or how it happened, but we'd established that there was drugs that shouldn't have been in there in those sort of quantities.
The blood result on Paul Crampton quite clearly indicates he has been injected with insulin, and rather a large amount of insulin for that level to show.
We could be as certain as it was possible to be certain that Paul had been given a large dose of insulin by someone. There genuinely was a case of malicious damage to children.
We've got certain evidence, definite evidence, that a crime's been committed. Someone has injected Paul Crampton with insulin which was never prescribed and which he didn't need.
Where did anybody have the opportunity?
It was our duty to find out how and why and when, and the sooner the better.
We needed to establish by the minute when anything might have happened to Paul Crampton, who was on the ward and where they were on the ward and when they were on the ward.
We went up there open-minded and we spoke to everyone just to get a picture of what was occurring.
Obviously it was somebody inside the ward, and that included the parents. Parents were probably suspects as well as anybody else.
I received a phone call from Lincolnshire Police, Grantham. The police officer said he'd like to come and see me. And then he proceeded to tell me that they had reason to believe that Paul's illness was the result of the maladministration of drugs. He then told me that my wife and I were both suspects.
A lot of murders and a lot of inquiries, it's a member of the family who's guilty of those offences.
There is such a condition called Munchausen syndrome by proxy, which is where the carer causes the harm so that they get the adoration as a carer.
And these parents were there when this baby had its relapses.
We had to establish when he was at hospital, what times he left, what time he got there, what he did when he was at the hospital, to establish if he had the opportunity to give Paul Crampton insulin.
It was apparent from the inquiries that Stuart made that this, what we now know as the insulin injection, was given to him on the 28th between 1:45 and 1:15.
And in my particular case, I knew I'd eaten some food in the hospital canteen, and the police were trying to match the time of me eating that meal.
When Paul Crampton had been given this injection, Mr. Crampton had gone for his lunch. He wasn't there.
I'm assuming that did eliminate me because I was no longer a suspect. It was quite an interesting set of emotions at that time. How could someone attack a child, particularly in a hospital, in a caring environment? But also a great sense of relief, because this meant that Paul did not have a long-term medical history, because of course at that stage we hadn't received any answers from the health service. They had not told us why Paul had had the hypoglycemic attacks.
When the inquiry started, obviously we were concentrating on Paul Crampton, but we did know that there had been another 30 incidents involving 14 children.
We knew that there was a hand somewhere that was harming children in Ward 4 at Grantham Hospital.
When assaults are happening to a number of children, it's not going to be the parent of each child that's attacking each child. So it must be a criminal on the ward. The medical staff, obviously, were always going to be the suspects.
The hospital really wasn't being protected, and those other children weren't being protected.
We needed to find out who was on the ward at what particular time, where were the nurses, who was taking lunch.
When you've got such a concentration of deaths and incidents happening in such a small place over a short period of time, it's horrendous.
Ward 4 at the Grantham and Kesteven Hospital has been the focus of the police investigation for 2 months now. Police were called in by the hospital manager and set up an incident room at Grantham Police Station, with 30 detectives working on the investigation. Detectives have had to decide whether 4 deaths and 10 serious illnesses among babies and children were coincidence or murder.
With any series of incidents, you've got to establish that they are connected. In this inquiry, obviously the connection was the hospital, that they were in the hospital. We needed to establish in detail if there was any opportunity when anybody might have administered something unlawfully.
Our job was to gather as much information as we could and go to the hospital, speak to the nurses, speak to the doctors, and try and find out what they knew, whether they were on duty, what had happened, what their thoughts were.
There was 22 nurses working shifts on that ward together over a long period of time with very sick children that needed looking after. So we had to get involved with the nurses and try and convince them that we were trying to do an inquiry here and try and find out what had happened.
The task they were performing was very, very upsetting to us. They actually were looking at everybody as a suspect, prime suspect, and that included me.
They all felt they were under suspicion.
It was very tense. When you spoke to people, they didn't want to talk. They had no idea what was happening and how it happened, and I think they were all looking for answers.
They started asking questions from us. What did you think of this? What did you think of that? And so on and so forth. That was very stressful indeed.
There was a degree of stubbornness, I think, amongst the nursing staff who certainly didn't want us there and didn't want to accept that perhaps something untoward had occurred, not only in their hospital, but on their ward.
This team of nurses work together all the time. They think they're doing a good job, they're looking after these children, they're trying to defend these children, and they see themselves as a team. So the police officers found it very difficult to break this barrier down.
They were reluctant to speak to us, I think mainly because we were interrupting their working routine. But also, I don't think anybody at that stage could believe that any crime had been committed.
Particularly the parents whose children had recovered were grateful to the nursing staff at the hospital for the work that had been done to ensure that their children survived. At this same time as we're conducting these enquiries, the incident room are instructed to look at staff that are working on the ward and to chart the nurses who have been on duty at the time of the collapses of the children.
The overall chart that was first produced showed a list of children down the left, a list of nurses across the top.
We're looking at anybody who might have had the opportunity to cause that cardiac arrest or that respiratory problem.
We established who was present, who was on duty, and getting a picture really of what was happening.
As that chart developed, it became quite clear that there was only one nurse who was on duty for all of the collapses.
The odds were about 500,000 to 1.
It's becoming more and more apparent that one name's being featured.
One name that came up over and over again was Beverley Allitt. She was a 22-year-old nurse who had recently qualified as a state-enrolled nurse. It was her first job within the hospital.
Nurse Allitt was present for each and every attack.
Beverley Allitt had the opportunity.
Over a period of 3 days, Paul Crampton had 3 collapses. Beverley Allitt was on duty for each and every one of them.
Beverley Allitt did not stand out at all, except as a young, quiet, pleasant person. And I remembered, if I ask her, Beverley, can you please get me this or the other? She, without any hesitation, used to do that. To me, that was a good nurse.
The first time I met Beverley Allitt was the 7th of May 1991. She was working on Ward 4 at Grantham Hospital, and she was one of many other nurses that I spoke to. She She appeared very friendly, very chatty, appeared to be willing to help, told me what she could remember.
I did not hear from a single nurse, single doctor, that Beverley Allitt was somebody we should really be worrying about.
She was a godparent to two of the children that were involved, and one subsequently died.
Nurses, if you like, were part of the family.
Parents trust their children to the hospital staff, and particular nurses.
What we expect from nurses is that they are carers. I don't think anybody suspects that nurses are killers.
A few days before the first collapse of Liam Taylor, the key to the fridge on Ward 4 had gone missing. The last person to have had it was Beverley Allitt.
The fact, obviously, that she removed the ward key to get the insulin, she had opportunity to do these crimes.
We didn't ever have her actually in a position where she was causing harm to a child, or anybody had seen her causing harm to a child. But we did have the circumstantial evidence that she was there all the time, and these incidents only ever happened when she was there. So at this stage, Superintendent Clifton had said, yeah, it's time to bring her in.
I felt that if we arrested her on the Crampton case, where we knew that there was a malicious attack, we could then begin to talk to her about other events.
I must admit, in those early stages, when she was arrested, I thought she would confess.
That wasn't the case at all. It was quite the opposite. We were totally wrong.
Could you give me your full name, please?
Beverley Allitt.
There is no direct evidence. There's no witness. She wouldn't answer the questions.
Why did you attempt to murder some of these children?
No reply.
The medical evidence was obviously key.
She was killed by an injection of potassium.
What I suspect is that you administered something unlawfully to Paul Crampton.
You accept what you want.
It was for the parents, more than anything, that we hope that the result went our way.
You Bill! You fat cow! I just can't get it through to nobody. I am not bloody lying. I will do it.